Rest, relax. It's there.
Okay.
It isn't falling off you now.
It's the ankle that is hurting.
Well, the swelling's come down.
Right.
And the skin looks good. But we'll always want to make sure before you have the surgery that there's no, we call them blisters, fracture blisters.
Yes.
That would make it worrisome to be operating. But you've been doing a good job staying off of it.
Definitely.
And that's helped, because that would be the only reason to have postponed things.
Yes.
Although I was not thinking that was going to be the case today.
Yes.
I also wanted to catch up with you, go over all the details.
Okay, Doc.
Do you have pain medicine at home right now?
Yes.
What are you taking?
Oxycodone? Yes.
Does it help?
Yes. I do not take it too often.
Okay.
Because I'm on so many other medications, Doctor.
Now, what about, how much more do you have? Do you have a lot? How much more of it do you have?
Most all of it.
Most all of it? Okay.
Yes. What the doctor requested me to only take Tylenol. She said that if I take the Tylenol, that should help me.
Yeah, but if you got real pain, you certainly can still take the oxycodone.
Okay. I may have more because of the X-ray of moving it.
Well, I'll give you another prescription tomorrow after the surgery.
Okay. I wanted to ask you because I was told myself to pre-med, but I had never did that before, no more than with my gym work. You know, other than that, it was always did at the hospital or whatever I needed prior to surgery.
Now, what's that now?
Pre-medication, will it be required?
No, you won't need any pre-medication.
Okay.
Not at all.
Very good.
Now, here is the ankle. And you broke both bones in the ankle. You broke the fibula bone, which is the skinny one on the outside.
Yes.
And then you broke the bone on the inner side. So you actually, we use this like here. You broke the bone right here, and then the other bone's broken like right over here.
Okay.
So tomorrow, when we get in the hospital, we'll get you up to the operating room. They'll put an intravenous. You go to sleep, and then we're going to fix it with plates and screws the fractures.
Okay.
Then when you finish, wake up, you're going to have something on like this, a splint. You go home, and about a week later, come back to the office. There's going to be like surgical clip staples in the in the ankle. And then they come out, and we put you in a nice cast.
Oh, okay.
Your only decision then is going to tell me what color you want.
Oh, great.
We have them in all sorts of colors.
Okay.
I think we got purple, we got pink, we got black, blue, all those colors.
Okay.
And I think that was it. I wanted to make sure. Do you have any other questions about the surgery?
How long will she? Is this ambulatory or will she?
I expect to be able to send her home same day.
I see.
Okay.
Yeah, if it looked like she was going to be struggling, we'd keep her overnight. Okay. So that's my prerogative. So I can always do that if it looks like we need to. But on the other hand, if you want to go, you say I want to go home and everything's set up to go home, there would be no reason to keep you.
Okay, very good. Okay, Doctor, I would like to know, when I was released from the hospital, I was sent home without any equipment at all. I didn't have anything. And my sons and daughters, they carried me from the car into the house, up the stairs, because at that time, I learned how to, which I had known about the procedures, to go up on my butt and come down on my butt. I knew about that. But I was there. I didn't have any equipment for about 2 days.
What do you mean equipment?
Like a walker or anything.
Well, I mean, I'm surprised at that only because that's, to me, when I have patients at the hospital, they tell me all the time that they won't let people go home until they know that all that equipment is been provided.
Doctor, I didn't have anything for 2 days. Not anything. A friend of the family.
Right.
He learned me his walker that he had used in the past, which the walker was in good shape.
Do you have one? Did they get you one finally now?
Yes, yes, they did.
Well, all I can tell you is I'll smack somebody tomorrow when I see them.
Well, they definitely, because there was pair of crutches in my room,
Yeah.
and they released me with the paper saying that I carried crutches home. I did not take crutches home with me because I was told I had not been trained to use them by the physical
All right.
therapies, and I couldn't take them home, so they was left there.
All right. Well, we'll work on that tomorrow.
Okay.
All right. Let me write a prescription. I'm going to give you a prescription for some more of the medicine. And then once the cast comes off, then we're going to be getting you some therapy.
Okay.
The therapist initially will come to the house.
Okay.
Any other questions right now about the surgery itself?
Will I be able to put in a pressure on it after surgery?
What'd you say?
Will I be able to put in a pressure on the leg?
No. All the surgery does for us, Francis, is make it so that the bones are back together again in the right place.
Okay.
It still takes about 6 weeks before it's healed enough that you can walk on it without, re-breaking it.
Okay. Okay.
See, the problem with the ankle is the pieces here are shifted. It'll heal like this, but if it heals like this, it's not gonna work well.
Okay.
So we have to put things back in the proper, we call it anatomic position, and let the body heal, which it will. That takes about 6 weeks.
Okay.
Maybe in a month, I let you put some weight on.
Okay.
So that would be the earliest.
Okay. But I would like to ask if you also, doctor,
Thanks.
with the walker,
Yeah.
and I suffer with AR. See, the left leg been having lots of pressure on it, and I can feel the pressure, like the side of this leg, see, in here, it's kind of
Yeah.
like bent. And I use the word bent, but it's another word for a live ankle, a leg or whatever. But from my door to the street to get in the car, it's a distance.
Right.
And I'm, hopping with the walker, and like my wrist, I have RA,
Yeah.
in
Yeah.
my wrist, and it's very difficult for me.
Well, this next month is going to be kind of a challenge. I mean, there's no two ways about that.
Mm-hmm. Mm-hmm.
This
Okay.
is dictation on Frances Wilkerson returns for evaluation. She's scheduled for surgery tomorrow and had sustained a bimalleolar fracture about 2 weeks ago. She's here with her in a wheelchair, home now, tolerating pain medication of Percocet. Splint is on. Examination of the ankle with the splint off shows the swelling coming down. The skin is intact. There's no blisters. Period. Capped a soft negative homing sign. Went over the X-rays taken today, which do show some displacement and instability to the ankle fracture. We have plans now to perform open reduction internal fixation tomorrow. It's expected about a week in the splint. At that point, follow up here with changeover to a cast, somewhere between 4 to 6 weeks of non-weight bearing. Thank you.
How long will the surgery be?
About 2 hours.
About 2 hours.
Mm-hmm.
Okay.
Okay. Doctor, the wheelchair belongs to the office here. This is a wheelchair. I do not have a wheelchair.
Okay, well, we're going to give you a prescription for one.
Thank
Good.
you.
Good deal. Thank you, doctor.
Oh, you're welcome. All right, wheelchair.
Yeah, okay.
Wheelchair.
Okay. Hold that.
Percocet the prescription, and then just give this to the ladies on the way out.
Okay.
Okay, thank you, doctor.
I'll see you tomorrow.
Okay.
Okay, thank you, doctor.
All right.
And I hope everything goes well.
And well.
'Cause
Thank
I'm
you,
like
doctor.
a big baby,
Now you'll be fine.
nervous.
The hardest part was breaking it.
And thank you for allowing me to record
You're
you.
welcome.
Okay,
Thank you so
thank
much.
Bye.
Bye-bye.
Have a nice day. Okay.